Hello, my name is Sarah Morgan. I am the Manager of Behavioral Health for Molina Healthcare of Wisconsin. Today, I'd like to talk to you about how Molina Healthcare was able to leverage WISHN to improve outcomes for our members. Molina Healthcare is a Fortune 500 multi-state healthcare organization. We have been offering quality healthcare for our members for over 35 years. Molina Healthcare currently covers over 4 million lives across 15 states. Molina Healthcare of Wisconsin was established in 2010. We currently offer Medicaid, Medicare, and Marketplace lines of business. Molina Healthcare of Wisconsin operates in 33 counties. We have a robust provider network of 127 hospitals and almost 29,000 providers. We currently cover over 90,000 lives in Wisconsin. Molina Healthcare of Wisconsin started using WISHN several years ago. Initially, we utilized the PAR report. We were able to receive a daily report of any of our members who had utilized the emergency department. We were also able to get a push list of updated contact information. About 3 years ago, we started using WISHN Pulse. Early when we started using Pulse, we were able to obtain updated contact information from face sheets. This was information that our members had provided to the healthcare providers that they were currently visiting. This was very helpful to us because currently, when a member signs up for Medicaid or any other line of business, they typically provide their contact information at that time. Oftentimes, our members can change phone numbers and addresses, and it does not get updated within our system. Having this information available to us within WISHN has been incredibly helpful. We can also see recent medication refill information for our Medicaid members. In Wisconsin, for Medicaid, medication refill and fill service is carved out to the state. This means that it is not something that we receive direct claim information on, as we are not the payer. We do receive a report from the state. However, WISHN is able to upload this information more quickly than we are able to access it within our systems. Additionally, we can see ED, encounter, and admission information. We also were able to review lab results that were available within the WISHN system. Today, Molina Healthcare utilizes WISHN Pulse and Patient Ping. WISHN Pulse has continued to evolve and offers more and more opportunities for us to better serve our members. It is very common for us to pull up WISHN Pulse while we are conducting our member care review team meetings. This includes our multidisciplinary care team meeting and our interdisciplinary care team meeting. During these meetings, we are oftentimes discussing members that have challenges that we are trying to come up with innovative ways to better help our members. By being able to review the information available in WISHN, we are oftentimes able to find more things about our members than we have within our own systems. We are able to see encounters that occur during ambulatory visits that we are not able to see nearly as quickly because of the delay in receiving claims information. We oftentimes will review lab results with our medical directors who help us determine any concerns that the member may have that we should assist the member with following up. Newer to WISHN is the addition of care summaries. We have found these to be incredibly valuable. Our care managers are here to assist providers with extending their reach into the community. Our care managers and transitions of care coaches work with our members to ensure that our members follow the care instructions that were developed by their providers. By having access to these care summaries, we are better able to assist the member follow those plans. We continue to utilize the medication information that's available within WISHIN. One opportunity we have found is being able to see the specific pharmacy information, including location where a member has picked up their medications. We can oftentimes contact the pharmacies to assist us with getting updated contact information to better assist us with connecting with our members. We have also found other increased contact opportunities. One such opportunity is through the face sheets to find updated contact information and also emergency contact information. We also utilize WISHIN for supplemental data capture for our HEDIS measures. We will look up information such as A1Cs, for example, or influenza vaccine data. About a year and a half ago, we started using Patient Ping. We are now able to get real-time notifications when our members are admitted to inpatient level of care, present to an emergency room, or are discharged from either of those settings. We are also able to better identify other care providers. Because so many other providers are also utilizing Patient Ping, we can identify any other providers who have added themselves to the patient's information. We can see, for example, if a member is enrolled in an FQAC and then contact that provider so that we can establish a relationship to better provide care coordination for that member. We are also able to notify other providers of Molina Healthcare care coordination involvement because we also add a tag for any of our staff that are actively working with any of our members. Patient Ping also allows us to generate reports that are very similar to WISHIN PAR reports. WISHIN has enabled Molina to better help our members. One great example is our member who we will call Scott. Scott very recently had an ED visit related to his alcohol use and other medical complications. Because we were able to obtain up-to-date contact information, we were able to get a hold of Scott. The information that we currently had in our system was outdated, but utilizing the information that he provided to the ED allowed us to be able to connect with him. Because we're able to get almost real-time notification of our members going into the emergency room, we were able to connect with Scott the very next day. Oftentimes, individuals who have substance use disorders will have changes in their readiness to change. We have found that connecting with our members shortly after an emergency room visit related to their substance use disorder increases the probability that that member will be in a state of readiness to change. In connecting with Scott the very next day, our chemical dependency coach was able to start assisting Scott with engaging in substance use disorder treatment. I am quite sure that if we had connected with Scott a couple weeks from now, after we received that claim from the emergency room, that may not have been the situation. Another amazing example is another member that we'll call Jeff. Jeff had over 40 emergency room visits in 2020. He had been unreachable every time we attempted to connect him. Unfortunately, Jeff has been experiencing homelessness. He also does not have a phone. Our case management staff that was working with Jeff did everything that she could to attempt to connect with him. She would contact every ED that he had been utilizing to attempt to have somebody give her a call while he was in the emergency room. Unfortunately, Jeff typically went to the emergency room after hours, and she was not able to connect with him in that way. She was finally able to connect with him when she utilized Wishin to look up emergency contact information. Jeff had entered his aunt's name and phone number within his health record. Because of this, our case manager was able to connect with Jeff's aunt, and she was able to connect our case manager with Jeff. Our case manager was then able to assist Jeff with housing resources, obtaining a phone, and establishing with the PCP. In addition, we were able to connect Jeff with our housing navigator, who was able to get him into some temporary housing and is now working with him on obtaining permanent housing. This will be a life-changing experience for Jeff. We really have so many of those stories. Our care management staff utilizes Wishin every day to help our members. Story after story of how we are able to finally connect with our members because of the additional contact information that we can find in Wishin, or that we are finally able to connect with an individual when they are actively ready to seek help and treatment. We have a staff member who spends a good portion of his time working with our members who have recently had emergency department visits related to substance use disorder diagnoses. His ability to engage members in treatment significantly increases when he can catch them shortly after they've had that emergency room visit. Without the ability to have that real-time notification using Wishin and Patient Ping, we may be too late to help somebody. Molina Healthcare of Wisconsin looks forward to our continued use of Wishin. Molina Healthcare will start to contribute medication fill data for both our marketplace and our Medicare lines of businesses. We are also working on a pilot program to begin sharing our care coordination care plans with other providers. We're going to be providing visibility of Molina Healthcare of Wisconsin staff contact information for providers. We are also looking forward to increased opportunities for collaboration with all providers involved with our members' cares. Our HIE team is looking forward to NCQA certified measures and source validated data being added to Wishin. Thank you everybody so much for your time. And I can't say how grateful we are to have Wishin as a tool for us to be better able to assist our members.